Hello, my name is Peter Lawrence, and I'm pleased to introduce the June issue of the Journal of Vascular Surgery and to highlight 4 outstanding papers which are freely available for the next 2 months. Our editor's choice article for this issue is Characterization of Syndromic, Non-Syndromic Familial, and Sporadic Type B Aortic Dissection by Drs. Shalhoub and co-authors from the University of Washington. Increasing data suggests that there's often a genetic component to type B aortic dissection. The authors determined the prevalence of heritable type B aortic dissection by studying 389 patients from 1995 to 2017. Syndromic type B aortic dissection included Marfan's, Loeys-Dietz, or vascular Ehlers-Danlos, while non-syndromic familial type B aortic dissection was defined as a family history of aortic or arterial aneurysm or dissection and or sudden death in a first-degree or second-degree relative in the absence of a known syndrome. Of the 389 patients, 71% were male, and the etiology was heritable in 28%. Patients with a familial type B aortic dissection presented at a younger age and with a lower blood pressure. Among patients with acute type B aortic dissection surviving to discharge, thoracic endovascular aortic repair, or TEVAR, was performed in 115 patients. However, those with familial type B aortic dissection had a greater incidence of retrograde aortic dissection after TEVAR, also required a greater number of arch repairs, and died at a younger age. Aortic-related mortality was more common among patients with syndromic type B aortic dissection. Our CME article for this month is entitled Outcomes Following Transfemoral Carotid Artery Stenting, Stratified by Pre-Procedural Symptom Status, by Solomon. Most previous studies of carotid artery stenting do not specify the degree of the presenting neurologic injury. Patients from the VQI Initiative database who underwent transfemoral carotid artery stenting from 2016 to 2020 were stratified according to their pre-procedural symptoms as asymptomatic, formerly symptomatic, or recently symptomatic, that is less than 180 days. Symptoms included stroke, hemispheric TIA, and ocular TIA. 27% of the transfemoral carotid artery stentings had a recent stroke, 9% had a recent hemispheric TIA, and 4% a recent ocular TIA, while 8% were formerly symptomatic and 53% were asymptomatic. The patients with recent stroke had a perioperative stroke or death rate of 5.5%, while those with a recent hemispheric TIA had a 2.4% stroke and death rate. And if they had a recent ocular TIA, it was 2.8%. In patients who were asymptomatic, the stroke rate was 1.4%, and they had a lower stroke and death rate compared with a formerly symptomatic category. These findings support symptom stratification by presenting neurologic injury in the preoperative risk assessment. The next article by Pather is entitled Long-Term Symptom Improvement and Health-Related Outcome Quality of Life After Operative Management of Median Arcuate Ligament Syndrome. They investigated long-term symptom improvement and health-related quality of life after operative intervention for median arcuate ligament syndrome. The patients were treated by operative management of the median arcuate ligament syndrome from 1999 to 2018 and were reviewed using a quality of life score and questionnaires. There were 100 patients with a mean age of 38 and 75% were female who were treated for the median arcuate ligament syndrome. Open surgical release was performed in 81 and laparoscopic release in 19 patients. The most commonly presenting symptom was abdominal pain, often with postprandial exacerbation. There was no procedural mortality, but major adverse events occurred at 30 days in 21 patients, 19 of them in open procedures and 2 with laparoscopic. And these included myocardial infarction in 1, pancreatitis in 2, respiratory failure in 4, an estimated blood loss of greater than 1 liter in 8, and postoperative ileus in 8. One patient treated by laparoscopic release required conversion for an aortic injury. The initial symptom resolution or improvement was reported to be 83%, and 18% with initial treatment success reported symptom recurrence. The 5-year freedom from symptoms was 67%. The final article by McGingle is Sex-Related Disparities in Intervention Rates and Types of Intervention in Patients with Aortic and Peripheral Artery Diseases in the National Inpatient Sample Database. They identified operations for abdominal aortic aneurysm, carotid artery stenosis, and peripheral artery disease from 2000 to 2016. And they also calculated the number of U.S. adults with abdominal aortic aneurysm, carotid artery disease that would require stenting, and PAD. Among the over 1 million hospitalizations, females were 25% less likely to undergo surgery for an abdominal aortic aneurysm and 30% less likely to undergo surgery for PAD compared with males with the same disease. Females were also less likely to receive an endovascular procedure for an abdominal aortic aneurysm or carotid disease that could be stented, and more were likely to receive endovascular repair for PAD. The authors propose that better abdominal aortic aneurysm and PAD identification and management in females may improve outcomes. Thank you for watching. For more information, please follow us on social media, and remember to like, comment, and share. We hope you enjoy these 4 highlighted papers and the other excellent papers in this month's Journal of Vascular Surgery. Remember that these articles are free to read until the end of August. And thank you for your attention.